Hello, everyone. This is Haley Mitchell. I'm from the Lewin Group, and I will kick things off today for our second Veteran-Directed Care Operations Office Hour session. We have a great session ahead of us today. But before we begin, I am going to cover a few logistics to be mindful of during our call. As you may have noticed, you all have been muted when you joined the call. We ask that you stay muted for the duration of the call so that we can avoid hearing any background noise that might disrupt the presentation. Use the toolbar at the bottom of your Zoom window where you can access the audio chat function as well as closed captioning. To turn on closed captioning, click the caret on the top right of the live transcript box, and a pop-up box should appear where you can select show subtitle to turn on closed captions. Please use the chat pod today throughout our session to submit any questions or answers to share with the group. We'd love for you to communicate with us using that method. We'll also be using Menti, and Menti is an interactive polling app. So please keep your smartphones or your internet browsers handy so that you can participate in the poll and our discussion. So we will be kicking things off today with a icebreaker, a Menti poll icebreaker. So if you all could go to menti.com, MENTI.com, and enter the code 95976270. We'd love to hear from you all on how many veterans you are currently serving through your VDC program. And I see we're already getting some responses in. And it looks like we have a mixed crowd here. Many of you are serving less than 10 veterans. We have, I guess the next two cohorts here are those who are serving between 50 and 75, and those who are serving over 100. It's great to get an understanding of the size of your VDC programs. For those of you who are joining us today, I know last session we asked how many years you have been a VDC provider. So thank you all for continuing to enter your Menti polling information. It's really great to see you also engaged for today's session. At this time, I'm going to turn it over to Victoria Wright at the Administration for Community Living, who will introduce the topics for today's session. Victoria?
Thanks, Haley. Welcome, everyone, and thank you for joining us today for our second VDC Operations Office Hour session. The VDC Operations Office Hour session is centered around the policies and best practices outlined in the newly released VDC Operations Manual Template. Excuse me. The Office Hour series will include up to 4 sessions and offer enough time for question and answers. Last month, our first session covered the intake process and the VDC assessment. Haley, next slide, please. For our agenda today, we will go over the FAQs from last month's office hour, and then we will go into a deep dive of spending plan development, monthly service report, initiating services, and hiring workers, and then facilitate and provide ample time for question and answers. As Haley mentioned earlier, if you have any questions, please use the chat function and take advantage to ask if you have any questions. We will have 2 more series to go, so please watch for our monthly newsletter announcing our next office hours opportunities. Now I'll turn it over to Heather to kick off the second office hour. Heather, the floor is yours.
Great. Thank you so much, Victoria, and welcome everyone. We're very happy to be here for our second session. And what I'm going to just do for those of you who may just be joining this for the first time is give a brief overview of the VDC Operations Manual Template, reminding folks that this was a collaborative effort across the U.S. Department of Veterans Affairs, which outlines the VDC program requirements and the VDC program best practices, as well as with the Administration for Community Living. And the intention behind the development of this Operations Manual Template was really to help inform the development of the VDC Provider Operations Manual with a national desire to really move the VDC program toward consistency, creating equal access, and helping it make it more efficient for providers to operate the program. And we covered in our first office hours last week the referral and intake and assessment. And this week we will be focusing on the spending plan, how to initiate services and hire workers, and ongoing monitoring. The overarching template is organized by these key areas that you see here, and we will be covering the balance of the topics of billing and invoicing and quality in future office hour sessions. So let's dive right in. What we'd like to do first is address some of the FAQs, or the questions that came up, as Victoria mentioned, from the March office hour. So if we go to the next slide, we'd like to cover the first question that came in, which is, can we get a place for all the various forms people use to buy the samples that we can all access? And the simple answer is yes. Based on provider feedback during the office hour session, we are developing a forms library on the TA community website where we will house the various forms that VDC providers use for their VDC processes. So this would include, for example, the intake process, the person-centered assessments, etc. And then to help us build that library, we are asking that VDC providers who would like to share their existing VDC form templates with peers to please forward them to the address listed here on the slide, which is veteran-directed@acl.hhs.gov, and we will then upload them to the shared resource. So we'd love to have everyone who thinks they might have something that could benefit their peers to feel free to share those, and we will post those. Let's go to the next question. Question came up around traveling veterans, and this is related to veterans who may kind of split their year across a number of locations. Maybe they head down to Florida or Arizona or a warmer part of the country. And so the question was, we received a referral of a veteran that spends part of his time in Maryland and another part of his time in another state. How can we assist this veteran while he is not in state? So really, it is possible in certain situations and under certain conditions that the current VDC program could continue to provide VDC program coverage for a traveling veteran. So the conditions where that would be acceptable would be where the veteran is spending time that isn't exceeding 120 days or about 4 months. And it's important that if it is going to be a longer stay in another state than the 120-day stipulation, it's encouraged for you to work with your VAMC to see if that would be the best situation for how to provide services to that veteran, or even due to the veteran's frequency of travel. You might want to consider if VDC is the best program for the veteran if there isn't really a stable location within which services can be delivered in a consistent manner. Other conditions include that the veteran's employee travels with the veteran and is going to be able to continue to be the employee when the veteran is in the alternate location. To see if there's video or, at a minimum, some type of telephonic communication that can be established and maintained between the veteran and the person-centered counselor at the provider agency to ensure ongoing communications, and that the person-centered counselor can keep up with the required care management and check-ins to ensure the veteran is doing okay. The VDC coordinator and the VDC provider need to agree that the VDC coverage is feasible and that the veteran will be able to manage their employer responsibilities appropriately while they're in their alternate location. And then the care must be provided within the United States or a U.S. territory. So for example, they couldn't be going over to Europe and having this happen. Let's go to the next slide. So for overspending, a question came in, if the veteran is overspending their global budget monthly, is that a reason for disenrollment? And we wanted to reinforce that really it's the responsibility of the veteran, which upon enrollment there is training and education, with the support of the VDC provider, to develop the spending plan that is below the authorized amount, and it's their responsibility to track and monitor that spending and make changes to the spending plan to ensure that it does not exceed the authorized budget. And we're going to get into that in a little bit more detail in today's office hours session. The remediation training and termination policy, it's encouraged that that is reviewed, and it aims to support the veterans who consistently spend over their average monthly budget and are at risk of exceeding their authorized budget prior to the end of their authorization period. So that is there and available and is highly encouraged so that is reviewed to be sure that they're understanding. The VDC provider is also responsible for applying the policy by developing a plan with the veteran to align spending with the average monthly amount and continue to review the spending with the veteran monthly. So this is a conversation that needs to be ongoing so that this is not coming out of the blue where the veteran is kind of unaware, or maybe they've lost track of, or they've maybe tracked it incorrectly, so that they can be kept on task. The VDC provider must alert the VAMC coordinator of the continuous veteran overspending. And if the overspending continues to occur, even though there's remediation training that is provided, the VAMC VDC coordinator may opt to work with the veteran to determine if there's a different VHA program that would better meet their needs. Let's go to the next slide. So here's a question then about disenrollment. So is veteran disenrollment determined only by the VAMC? So let's review a little bit of the expectations. And again, these are outlined in greater detail in the template. Veterans may voluntarily disenroll at any time by notifying their VDC provider or their VDC program coordinator. So it's not just determined by the VAMC, they are able to self-recommend to voluntarily disenroll. Additionally, veterans who demonstrate the inability to self-direct services, either due to a misuse of funds, or maybe there's a consistent non-adherence to the program rules, or they present an ongoing health and safety risk to themselves or others, they must select an authorized representative to assist them with their responsibilities as it relates to the requirements for self-direction. Veterans who refuse to select an authorized representative or can't find or locate a representative who is willing and able to manage the services, or maybe they've lost an authorized representative if already required for program participation, and then they cannot find a suitable replacement. In those circumstances, they would be required to disenroll from the program. In those instances, the VDC provider and the VAMC program coordinator would then help the veteran locate suitable alternative services. So we're now going to pause and we're going to engage you in a Menti poll. We'd like you to go up and enter the code 95976270 and respond to the question, do you have a process in place for sharing and reviewing monthly service reports between the ADNA and VAMC for veterans enrolled in your VDC program? And we can see already very quickly that the majority of responses coming in are that yes, you do. And that is very, very good. Give it some time here for those responses to continue to come in. A few unsures, very few no's. And we're still seeing the majority of responses come in that yes, you all do have a process in place for sharing and reviewing your monthly service reports. And I'm sort of seeing a pause in the responses at this point, so maybe we can go ahead and move to the next slide. It seems as if overarchingly, there's a trend that you are all on top of that. We're now going to take the balance of our session today and focus in on the 3 areas of the operations template, manual template, to talk about the spending plan development, the monthly service reports, and then initiating services and hiring workers. So let's first talk about the spending plan development, and we can go ahead to the next slide. So VDC providers assist in arranging veteran-directed services based upon the needs and preferences of the veteran. In addition to ongoing options counseling and counseling support services that would include care management and fiscal management services, this support initially results in a person-centered assessment and the veteran spending plan. The person-centered counselor uses a person-centered approach and meets face-to-face with the veteran or virtually if necessary to develop a spending plan with the veteran according to their needs and preferences. There is a VDC monthly spending plan template. When you get the slides for this event, I believe you did, there's a hyperlink to that. And you may use this to help map how the veterans intend to use their budget and estimate the spending during their authorization period. This is a very helpful tool that gives you a line of sight into the future and to help guide that veteran into the development and selection of services and supports that not only best meet their needs, but also can forecast what that spending will look like. The veteran spending plan delineates the amount the veteran is estimated to spend each month. So it will help outline the workers hired by the veteran and the goods and services the veteran plans to purchase. And those are goods and services that also include one-time purchases as well as planned purchases for the future. The VDC then, it compares the spending plan amount against the total budget, which helps the veteran, the person-centered counselor, the VDC provider, the fiscal management service, and the VAMCs in monitoring the spending to ensure that the veterans do not exceed their authorized budget. So as we talked about earlier with that question, here are some really concrete tools that are at your disposal and are already there that you don't have to build from scratch so that you can help the veterans stay on track with their spending. Let's go to the next slide, please. So the person-centered counselor updates the spending plan throughout the year. And this is designed to reflect any changes in need or circumstances that the veteran might experience. Veterans also may initiate changes or changes may occur under the guidance of a person-centered counselor and then be communicated to the VA staff through the VDC provider. So the person-centered counselor will submit the spending plan to the VDC program coordinator, and it's important to remember this must be done within 5 days of completion, and it needs to be on a form that is approved during the VDC provider's readiness review process. And we wanted to highlight again the things that need to be included. It needs to include the services, supports, or goods that are going to be used to help the veteran remain in the community, how and why the service, support, or good is going to help the veteran, the who is going to provide it, so anyone that's going to be hired, the specifics for which services, supports, or goods. It needs to include the start and end date of the plan, include the frequency, hours, and amount, and then the costs associated for those services, supports, or goods. And again, the template outlines all of this and makes it very, very easy for VDC providers to go in and track this, and it's nicely organized. Let's go to the next slide, please. So after the person-centered counselor submits the plan and any other supporting documents that are needed to the VAMC, the VDC program coordinator then reviews it to make sure that there isn't any duplication in services and that they're all connected to the person-centered assessment. Again, it's the person-centered assessment that's driving the identification of the veteran's expressed needs and preferences, which are then incorporated into the services that are going to be used and paid for through the spending plan. And once these are approved, the copies of the authorized plan are then distributed and shared across the veteran, the VDC provider, the person-centered counselor, and the fiscal management service entity, so that everybody has the same information. The VAMC either approves or proposes changes for the VDC provider to review with the veteran. The person-centered counselor will support the veteran in making any required changes. The VAMC determines if any supporting documents are necessary and should be reaching out to the VDC provider to outline what those supporting documents should be. And then the VDC provider should be retaining a copy of the approved spending plan in its files. There are mid-authorization adjustments, and we will be getting into some of those topics later on in the session today. Let's go to the next slide, please. So there are updates that may be made to the monthly spending plan. One thing we wanted to talk about is the emergency backup plan. So the spending plan does include an individualized emergency backup plan, and that is to assure that services are delivered in the event that something unexpectedly occurs. And this backup plan is reviewed and at least quarterly to make sure that the available and availability of the persons listed in the emergency backup plan are still current, accurate, and or whether anything else needs to be modified. It may also include details on the hiring agency services, if a VDC worker needs to take time off, for example, or maybe there's unexpected time out of the office, or maybe there is a planned vacation. The person-centered counselor ensures the spending plan balances with the budget and meets with the veteran's service needs. The person-centered counselor then updates the spending plan throughout the year, and the veteran also may initiate changes on their own behalf, as changes may occur under the guidance of the person-centered counselor, which then need to be communicated to the VA staff through the VDC provider. It's important to remember that only items that are in the approved VDC spending plan will be approved. So it's very important to review and go through all of this on a regular basis to be sure that things are not inadvertently denied because they weren't accurately documented in the VDC spending plan. Okay, let's go to the next slide. So now we're going to talk about monthly service reports. Go to the next slide. So each month, the VAMC VDC program coordinator receives a detailed report of the veteran's spending for the previous month, and this explains the hours of care the veteran received, as well as the wage rate, the purchases of goods and services, and any administrative fees. So the VDC providers need to keep a detailed record of their veterans' monthly expenses and share it with their VAMC partners. And at a minimum, the report needs to include their average monthly spend and budget, their monthly administrative fees, the amount that was spent on goods and services, those that were spent on the emergency backup care and any planned purchases, and then the total veteran budget for authorization spent and remaining to date. And again, we encourage that VDC providers use the template to track the VDC spending by documenting actual spending. Let's go to the next slide, please. Then there is a monthly service report. And in the report, only items that are included in the approved VDC spending plan, again, we're reinforcing this throughout the session today, will be approved for payment. So if the VAMC VDC program coordinator is finding a discrepancy between what they're looking at on the spending plan and what was actually expended that month, they're going to direct the VDC provider to review the spending plan with the veteran and make any appropriate adjustments that might reflect any care needs. Maybe there's changes, care needs of the veteran. Let's go to the next slide, and we're going to switch topics now, and we're going to go over the process for initiating services and for hiring workers. So for initiating services, VDC workers hired by the veteran before I get into the details, let me cover the high level part. After the VAMC VDC program coordinator approves the spending plan, it's important to remember it's the veteran that's responsible for organizing the services, the supports, and goods needed, and for also recruiting, interviewing staff. But this is also done with support from the person-centered counselor as desired. The veteran may be quite capable of doing this, or maybe they also have family support that is going to help them do this. But remember that the person-centered counselor is always there to be able to assist the veteran in these important tasks that they're responsible for. The hiring requirements are dictated by the VAMCs and the VDC providers, and they also need to be in accordance with state policy. So VDC workers hired by the veteran won't be paid an hourly rate that exceeds the hourly rate allowed by the state program for agency services. And so the average VDC worker hourly rate ranges at the time when we put this template together from $15 to $20 an hour, which excludes the employer tax costs, but it may be exceeded if necessary. Veterans as employers have the right to determine and establish hourly rates within the funds that are available within their spending plan. It's important to note as well that the veteran hires employees who are legally allowed to work in the United States and may not be the veteran's authorized representative. So let's talk about the next piece of this, which is once they're getting to the point of identifying someone, there needs to be a corresponding background check process. So all VDC workers must complete the background check before employment and before the veteran can begin using their services. And these procedures are specified by the VDC provider in accordance with state policies. The background check results are reported to the VDC program coordinator. If the veteran insists on hiring someone where a concern is present, the veteran is required to sign an informed risk agreement or a waiver. It is recommended that the veteran develop a risk management plan related to the hire with their person-centered counselor, which would be monitored multiple times during the year and updated as appropriate. If the worker does not pass the background check, the VDC program coordinator needs to inform the veteran and the authorized representative. And there may be instances where the results show other events that are not disqualifying, but they are presenting a concern for the veteran's health and safety. So in these instances, the person-centered counselor would discuss this with the veteran and the authorized representative so that the veteran can proceed with making an informed decision. Let's move to the next slide, please. When it comes to the worker payroll, the Fiscal Management Service entity develops the policies for the payroll and timesheets, and that includes the frequency of the payroll, the processes for the completion of timesheets and what is expected for submitting those timesheets to the FMS, the process for paying workers, so this would include whether it's check by mail or whether it's a direct deposit, any payment that would be needed or expected for overtime, which needs to be in accordance with the federal and state law. It's important to remember that the VDC provider must stress the importance of the accuracy and the timeliness of submission of the timesheets. And workers who are paid for hours not worked can be criminally prosecuted for fraud. So this entire payroll process is very important to do it accurately in accordance with the FMS policies. Let's go to the next slide, and we're now going to cover a few FAQs as it relates to wages and payments. So a question came in, if a veteran manages their workers, are they able to determine the wages for their workers within the guidelines of their budget? Does the wage have to meet legal guidelines? So veterans as employers have the right to determine and establish hourly rates within the funds available in their spending plan, as I mentioned just previously, and that although veterans are determining the hourly rate, the VDC workers hired by the veteran won't be paid an hourly rate that exceeds the hourly rate allowed by state programs for agency services. So as I mentioned, currently at the time this was written, that ranges from $15 to $20 an hour, but may be exceeded if necessary, and that is excluding the employer tax costs. Let's cover another FAQ, the next slide. So in relation to employee benefits, a question came in whether there's any consideration to offering sick vacation time to workers with the program expansion. And veterans must comply with state and local policy requirements as it pertains to employee benefits. If a veteran opts to include more paid time off than required, and this is by state or local policy, the person-centered counselor needs to document that in the spending plan, and it may, in fact, impact the hours of direct care service that the veteran is able to allocate in their budget. So it's important to really understand this so that the veteran can be making those informed decisions and balance that out with what they actually need in terms of the delivery of services and also the impact on corresponding budget. We're now going to pause and take some questions and comments, and then as time allows, we have a few other topics that we'll get into. Pat, I'll turn it over to you.
And I can jump in here to help triage some of the questions that have come through via chat. Thank you all so much for continuing to engage and raise these questions. We'll do our best to get through all of them on our call today, but please know that any questions that are not answered on this call will either be shared via an FAQ that will be distributed after the call or covered during a future office hour session. And any question that we cannot answer on our call today, we will do our best to look into and get an answer to you as soon as possible. All right. So with that, we'll go in order here. And the first question is, may a veteran hire a caregiver that lives out of the state for temporary care? And I'm just checking our participant list. Pat, would you be able to answer this question?
Yes, veterans living out of state, right, Haley?
So are they able to hire a caregiver that lives out of state?
So the answer to this question is yes. There's nothing that prohibits this from happening. We can think of plenty of programs where a veteran may live close to a border of another state where workers could come from another state. I live in the DC metro area, so you could have, workers from Virginia, Maryland, or DC. So it is permissible. As a whole, there's no restriction. Obviously, there are things that need to be thought about. If the person lives 2 hours away, are they able to reliably get to the veteran's home? There would be other things to think about along with that. In addition, your FMS provider, your VDC provider, will be able to work towards making sure that workers are paid in accordance with all federal, state, local policies. I know Sue Flanagan knows those well, but obviously a worker's residence may factor into that. So, but there's no restriction overall.
Thanks, Pat. The second question that came in is around planned overspending. And specifically, the question is asking if a veteran is on hospice and the overspending per month is planned and intentional, is that allowed with the understanding that there is an approved spending plan for allowable goods and services? In this case, I believe that this would be permissible as long as this is documented in the spending plan and approved by the VAMC VDC coordinator. Pat, is there anything else you'd like to touch on in this case as it relates to hospice?
Yeah, I think you're right, Haley. The short answer is yes. There's always some complexity. So spending plans need to include information around how much workers are paid, their traditional schedule, their estimated monthly spending. So if when we read that question, overspending is planned and intentional, that means that the medical center is aware that the veteran will be receiving X amount of care, and here's the estimated monthly spending, and all of that is in accordance with the spending plan. So we need to make sure that when we say that spending is planned and intentional, that the spending plan that's approved includes those core components, which are outlined in the policy and procedures manual. It's outlined in the billing guide. There's a spending plan template you can use. So assuming all of that is completed, the short answer is yes. Medical centers are only required to pay what's approved in the VDC spending plan.
Thanks, Pat. All right, this next question here is, where do we find the remediation and termination policy? So we make note or make reference to the remediation and termination policy in the Veteran-Directed Care Billing and Invoicing Guide, which can be found on the No Wrong Door website. We do also have a template that VDC providers can reference for this policy, which we can upload along with the forms that we'll be sharing on the VDC TA Community Forms Library that we are in the process of developing. All right, this next question is, someone is wondering about the Menti poll regarding program size, and we can be sure to distribute some of that polling information in our next VDC newsletter, that you all can get a copy of who all joined today and the size of your VDC programs. All right, the next question is around monthly service reports and timeframes around when a medical center needs to review and provide feedback or approval of the monthly services report to the person-centered counselor. Do we have standard timelines for that are appropriate for the time period when a medical center needs to review the monthly services report or monthly spending plan and return it to the person-centered counselor?
Oh, so it looks like, let me see. Haley, there was just a chat that this was in comment to the monthly spending plans, not monthly service reports. Let me just pause for a minute and see if I should answer it that way.
Yes, I
Okay.
believe so. I think let's frame it in reference to the monthly spending plan approval.
Yeah, so great question. Dan, I'm going to defer to you first. I don't believe that there's a time frame when it's required to be approved. You know, if you submit it today, we'll get back to you in 2 business days or less. I do not believe that's a requirement, but Dan, can you confirm?
And Pat, I believe Dan had to temporarily hop off the call.
Okay, so that is my understanding, that there isn't a time frame requirement. So let's talk about best practices. We know that close communication is key between medical centers and providers, particularly in instances where those communications are about getting veterans access to services. So I would say when a spending plan is submitted, as much as it can be expedited for review and approval, knowing that that's frequently the last step before veterans begin using their services or amend their spending plan to better meet their needs. So there's definitely an expediency there. There are times when there are questions, when there's more discussion that needs to be had. One best practice, think about standing meetings. standing weekly meetings to review spending plans or service reports or any updates in veteran status. You could have a standing weekly meeting that's 30 minutes long just to tackle those quick things, a monthly meeting that's more about programmatic operational questions, improvements you want to make, questions about the program overall that you need to spend talking through. So if you have 30 minutes or an hour on a calendar every week, you know that you'll be able to bring that up between the respective partners. So just a strategy, something to think about, and would also just recommend every program should look at what are those common protocols? How are you submitting them? Is it through email? Is it through fax? What is the typical turnaround? Is there anything that can be done at time of submission to kind of get them through quicker? It's possible that something's a little bit delayed because maybe there's more detail that could go in the spending plan that the medical center would want to see. So work through those, talk through them operationally, but think about maybe a set time to talk about these questions.
Thanks, Pat. All right. Another question came through about certain findings on background checks. And the question is around whether a good cause waiver is required. Let's see. Sue Flanagan, I believe you should be able to unmute, but if you aren't, I'm wondering if we can.
Hi, yeah, I'm here. Can you hear me?
Yes, I can hear you.
And what was the term again? A good what?
A good cause waiver.
Waiver. One, just so everybody knows, criminal background check information and requirements do vary by state. And so some states actually have some categories that cover any worker who has got, let's say, a criminal background check that is a felony for abuse, neglect, or exploitation of an individual. They also have expiration periods for when these are no longer in effect or the worker can pursue other work. So it does vary. Now I'm just looking in because the good cause waiver is a new term to me. Let me just quickly look that through. But again, VA policy is a disqualifying event for employment would be a person who has a felony that is related to fraud, abuse, or neglect of an individual of any age. That's the minimum disqualifying event. Let me see, good cause waiver. But again, it's important to look at your state. Oh, here we go. Good cause waivers. Now I'm looking at, this is just a state that has a good cause waiver, and it's Health and Senior Services in Missouri. An individual who has been disqualified from employment with one of the above provider types has the right to apply for a good cause waiver. So I guess the worker would apply for these if they are in effect in the state that you're talking about. So, and in Missouri, it's section 192.2495, RSM little o, requires regulated healthcare employers such as long-term care facilities, blah, 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 and consumer-directed programs under contract with the department to obtain background screenings. So they require a background check. And I guess that in Missouri, an individual has been disqualified from employment with one or more of the above provider issues, has the right to apply for a good cause waiver, which is granted, if granted, pardon me, would not correct or remove the finding, but would lift the hiring restriction and allow an individual to be employed. So this is just an example in the state of Missouri. So you would have to review your state background check requirements to see if a good cause waiver would be allowed.
Thanks so much, Sue.
You're welcome. Oh, Haley, while I'm still unmuted, one thing about hourly wages, I just wanted to stress with people is that obviously the minimum wage that can be paid is the minimum wage in the state. You can never pay somebody less than minimum wage. And DOL does have this companionship exemption, which the worker doesn't have to be paid minimum wage and overtime. However, due to the healthcare rule that was passed, it is almost impossible for Medicaid or a veterans program to use companionship because they've tightened the provision. So a good rule to go, a worker is never really a companion, doesn't qualify for the companionship exemption. However, they should be paid minimum wage at the very least for every hour worked, and overtime if they work over the overtime requirement hours for a state's labor department. Just one more thing.
Thanks so much, Sue. Very helpful. We appreciate you weighing in on those two questions. All right. We are going to try to get through a couple of more questions on our call, but again, I just want to note that anything we don't answer today will either be answered in the FAQ following the call or in a future office hour session. All right, let's take a question about overspending. So if the veteran is responsible for their program or their spending and overspends beyond the spending plan amount, the VA may not pay the amount back to the agency due to it not being approved overage. Is that correct? So I think with this question, we would like to stress again that all spending has to be approved by the VDC program coordinator at the partnering medical center. It is true that VA is not obligated to reimburse for any spending that goes above the authorized budget for the veteran. Pat, would you like to share any detail or best practices on cases when this would happen?
Yeah, it can happen for a lot of reasons. It is really important that there are some certain times when the veteran should be closely monitored and adhering to their spending plan. Anytime the spending plan is new, and then particularly near the end of the authorization to make sure that they don't go over. Having a lot of detail in the spending plan, making sure that the veteran understands that spending plan. So they have these workers, but what is their typical tour of service? What hours do they work? Do they come at 8 and leave at 12? Do they come in the evening for 2 hours? So when there's deviations, you're able to really work with the veteran to identify when those are. Is the worker coming at 8, but the veteran is making them stay till 2 every day? That could cause overspending. Well, then what's the root cause of that? Does the worker and veteran understand their schedule? Is there a breakdown in that understanding? Do they understand the impact of working those additional hours and what it means on their budget? So looking at spending plan early, looking at it late is really critical, making sure there's a lot of detail. And then reinforcement, training, education. I know that's easier said than done in many of the situations where this is a problem. And then in those situations, there needs to be open conversations. So just a couple best practices there.
Thanks, Pat. All right, I am looking through our list of questions. I know that there were a couple of questions that came in regarding background checks and some specific information around there, some of which can be found in the Operations Manual Template. There was a webinar that was facilitated in 2022 that is on the ACL No Wrong Door website. There's a recording and slides that covers the topic of VDC workers, which Sue Flanagan actually presented on and shared some detail that might help you with some of these questions that we might not get to on our call today before we close. There are a couple of quick questions here. There's a question about the VA VDC Field Guidebook. I believe this was released and it is available for VA medical centers on the VA SharePoint. So if a VDC provider is interested in reviewing the field guidebook, I would coordinate with your partnering medical center to receive a copy for that. All right, just taking a look here again. See, Pat, any other questions that you think we could answer quickly in the last 2 minutes that we have before we need a shift?
I don't think I have anything else, Ellie.
All right. Well, great. So I am going to transition us now at this point to our closing, and also want to hear from you all about anything you know, that you might consider doing differently as a result of what you learned from this office hour session today. If we could go to Menti again and enter the code 95976270. We'd love to hear from you. We are also in the process of planning our next office hour sessions, which will go over any questions that you all have, as well as another deep dive into review of some of the topics as outlined in the Operations Manual Template. There are some questions around where to access slides and recordings from these sessions and from our webinars. And I just want to note that the ACL No Wrong Door website has a section on it where we post resources, including slides and recordings from past webinars and office hour sessions. So if you are looking for any of the materials, the No Wrong Door website is your go-to. And we also have emails that are sent out from the veteran-directed mailbox. We have the VDC email distribution list. If you are not already signed up for it, we have a form that you can enter your information on to be included on that. And we distribute any of the materials following these sessions, including the recordings, the slides, FAQs, to that distribution list. So that's a second place where you can access these resources. All right, well, I think in terms of learning, we're learning from a lot of you that some of you have some solid processes in place, and some of you will continue to review and look at some of the policies and procedures and best practices that we have laid out during these calls. So as always, we so appreciate your participation and look forward to future sessions with you all. At this point, I'm going to turn it over to Victoria to close us out and share a couple of reminders.
Thanks, Haley. In closing, we would like to share a couple of reminders, but first, thank you all for your participation in joining our second VDC Operations Office Hour. I also would like to thank our VA partners, Dan, Andres, and also our VDC team, the Lewin Group, for putting all this together. As I mentioned earlier, we still have 2 more office hours left. Please watch for our May newsletter for the next VDC Operations Office Hours. The topic, dates, and time will be released in that VDC newsletter. For our third third VDC Operations Office Hour, topic will be on billing and invoicing. As always, your feedback is very important to us, and we ask everyone to please complete the post-event survey, and that will be very helpful for us to identify if you have any other question or any topic that we need to work on. Furthermore, to continue the conversation, please use the discussion board located in the VDC community on the ACL TA community website. If you do not have access on our discussion board, please email your VDC inbox at veterandirected, one word, at acl.hhs.gov. And also, please remember to continue reporting your veteran census, the data monthly using the VDC monthly reporting tool. And finally, if you need any technical assistance, feel free to, again, email the VDC inbox, which is veterandirected, one word, at acl.hhs.gov. Thank you, everyone, for all your work supporting our veterans, and be safe and have a good afternoon.